While in India, and with this I finish, a lot of people would ask me, Ambassador, you must be playing a lot of golf. And I said, why? Well, you must have a lot of time in your hands. Chile is a small country and so far away. I'm sure there are very few issues with India. Well, I would respond, do you know that Chilean trade with India is bigger than India's trade either with Pakistan or with Bangladesh? These are countries of 150 million people. They used to be part of India. They're the neighbors of India. They trade less with India than Chile does. Now, that is globalization for you, and these are the opportunities that are emerging in this brave new world. You may have heard of something called the Nano. The Nano is the people's car built by Tata Motors, $2,500. That's the price of an average motorcycle. And it's being developed not by the Japanese, not by the Germans who built the first people's car, the Volkswagen, but by the Indians. Tata Motors, incidentally, I don't know whether you know this, I'm sure the names Jaguar and Land Rover resonate in a Jamaican environment. Well, they are now Indian brands. So this gives you an inkling of the way the world is changing. In short, the post-American world offers enormous opportunities, and that is one reason Latin America is changing so fast and so quickly. And in that environment, the changes that we are witnessing in Cuba, it seems to me, have considerable chance of succeeding and seeing a lot more interactions with the Caribbean and with the broader Latin American environment. Thank you.
Good morning, everybody. This conference focuses on the future of Caribbean-Cuban relations. Now, it is true that Cuba has entered a somewhat uncertain period after 50 years of being governed by the 1959 generation of revolutionary leaders. Nonetheless, I argue that the future of Cuban-Caribbean relations will continue to be influenced by, in part, by geographical proximity, by the existing patterns of cooperation, and by long-standing transnational linkages. For example, one of the things about which we should remind ourselves is that Caribbean migration to Cuba during the first 3 decades of the 20th century was crucial in shaping one aspect of contemporary Cuban demography. There are an estimated 1 million Cuban citizens who are descended from those Caribbean migrants, Jamaicans, Haitians, Barbadians, Antiguans, etc., and family ties remain. I know Antiguans who travel to Cuba to see their elderly uncles and so on. Similarly, the years since 1972 have been defining years for the political, economic, and social relations between Cuba and the countries of the Caribbean community in particular. Today I'm going to speak about human development cooperation between Cuba and the Caribbean. Basically, I'm arguing that it is the future, it is the present that will define the future in some ways, in that very important human development relations are taking place at the moment. And it's up to us, in part, as to how those continue. Now, I intend to focus on Cuban-Caribbean cooperation in the areas of health and education. Now, these are important human development issues in a region where human resources are among our most significant resources. Moreover, health and educational cooperation signifies a specific type of interdependence, a considerable movement of people, and human contact, which leads to the construction of long-term societal ties between Cuba and its neighbors. Now, I would like at this point to mention that my data is preliminary and it's derived mainly from online reports and media sources. Although I have begun to request information from the governments concerned, there has not been the time to obtain responses from many of them. And I gratefully acknowledge the invaluable research assistance provided by Sherry Ann George, one of the graduate students in the Department of Government. Now, official contacts between Cuba and most Commonwealth Caribbean governments began excuse me, in 1972 with the establishment of diplomatic relations with Barbados, Guyana, Jamaica, and Trinidad and Tobago. Now, that event launched an era of technical cooperation in a number of areas. The pattern has been that Cuba provides the bulk of the cooperation, and CARICOM countries have reciprocated mainly with goodwill and political support in international fora. Between the latter 1970s and 1983, Jamaica, Guyana, and Grenada were the major participants in these technical cooperation arrangements. After the collapse of the Grenadian Revolution, there was a hiatus in Cuban CARICOM relations, which lasted for much of the decade. Relations resumed in the 1990s. Now, I recorded in 1997 that Caribbean actors showed rather ambivalent attitudes and policies towards Cuba. They were supportive of political and economic change there, but acutely aware of Cuba's potential to become a devastating rival in key economic sectors. While there was much sympathy, support, and admiration for the Cuban government and people, images of Cuba projected by the US media and the testimonies of some Cuban dissidents also influenced public opinion in the Caribbean. The strategic response of Caribbean governments and private sector actors was to explore greater interaction with Cuba through trade, tourism, and technical cooperation. And so the CARICOM-Cuba Joint Commission was established in 1993, and in 2005, the CARICOM-Cuba Trade and Cooperation Agreement was concluded. Now, these have been supplemented by a number of bilateral commissions and bilateral agreements between Cuba and individual countries. By far the most substantial programs carried out under such agreements have been those related to education and health. Cuba has greatly strengthened its positive image and the interdependence between itself and the rest of the Caribbean by means of the scholarships and the medical assistance it has provided, even during its own time of extreme economic hardship. The government-to-government agreements on providing teams of Cuban medical professionals to work on 2 to 3 year contracts have also generated some hard currency for the Cuban government and have provided somewhat higher earnings for the Cuban workers stationed in other Caribbean countries. A nurse in Cuba, I believe, earns about $15 a month, at least from the figures I've seen. Working elsewhere, that person might earn up to $200, not much, but a lot more than at home.